Good afternoon, everyone, and thank you for joining us today. This afternoon, we'll be speaking to Dr.Helmy Haja Mydin, Consultant Respiratory Physician and Co-Founder of Asthma Malaysia, on debunking myths on asthma. Hi, Doctor. Thank you for joining us today.
Hello there. Thanks for having me today.
Yes, it's our pleasure. Okay, so today, Dr. Helmy will be helping us to debunk some of the common myths about asthma that you might have heard about and reveal the truth. So, straight to the myth. Myth number one. Asthma often goes away as the child gets older. What are your thoughts on that, Dr. Helmy?
Well, it doesn't really go away because it's always there in the background. Now, to understand that, we need to understand what asthma actually is. And asthma essentially is a condition where your airways become inflamed. And as a result of that, it becomes more narrowed, it becomes more sensitive to your surrounding. And because of that, you become very symptomatic. So you get your typical wheezing, chest tightness, sometimes a bit of cough and a bit of sputum or phlegm production. Now, as you grow older, the sensitivity or what actually triggers your asthma may change. So what tends to be very common is as a child, you get recurrent bronchitis sometimes, you're exploring a new world, there are new allergens, new viruses that would be something very novel for your airways. But as time goes by, these become less and less of an issue. And usually, if you have asthma as a child, by the time you're a teenager, things are relatively well controlled. Now, that doesn't mean it's gone forever. It can also be that in some cases, you don't ever get it again, or you find that certain triggers, perhaps at a different threshold, becomes more of an issue. So sometimes we find patients who had asthma or bronchitis as a child having similar symptoms, similar problems when they are in their 20s, 30s, sometimes even when they are in their 50s and 60s. So it may appear to be more common, and of course, typically we tell kids that they grow out of it, but unfortunately, it's not as simple or straightforward as that.
Okay, so what you're trying to say is that even when you have asthma when you're younger, you might have it as you grow old, or sometimes the symptoms won't be as strong as it were when we were young.
So what I'm trying to say is that the actual condition doesn't go away, but what triggers your asthma may differ. So what may have been a very easy trigger when you were a child may not be so relevant when you're an adult or perhaps even as a teenager. So it doesn't go away in the sense that you're cured, that it's gone 100%. It's just that things that previously would have triggered your asthma would not be so much of an issue anymore.
Okay. So I have asthma since I was young, a baby actually. So like, I agree with what you say. It might not have been as worse as it were when I was young, but like sometimes when I have terrible flu or I can't eat rambutan for some reason.
Yes, okay.
It wasn't.
You should have told me this earlier. You could have answered the question yourself, right? But what you're highlighting is actually a very good point because essentially you have identified what are your triggers, and perhaps the range of triggers are not as wide. It's a bit more narrow now compared to when you were a child. And just as importantly, what's applicable to you may not be applicable to someone else. So you have highlighted rambutan. There'll be many others out there with asthma who can eat rambutan, but also there'll be some who can't. So that tells you all about the fact that as an individual, your own triggers may be different.
True, definitely. Okay, so now for myth number 2. Asthma medications are only needed during asthma attack. Is that true, doctor?
You see, now that I know you've got asthma, I feel you should answer the questions and then I can correct you if you're wrong because we are the patient, right? So it's very important that the patient actually tells us whether things are true or not. It'll be more interesting that way. But to go back to what you said, and perhaps you know this already, when it comes to asthma, you don't actually have a clear answer. It's not as simple as taking medication only during an attack. Now, there's that old adage of how prevention is better than cure. So it's the same thing here. You want to take an inhaler that actually prevents you from having an attack in the first place. So going back to my earlier statement about how asthma is a condition where there's inflammation in the airways, what you want to do is you want to decrease the inflammation. You want to keep things as nice and stable as possible to prevent attacks from happening and to also reduce symptoms. Now, with that in mind, generally speaking, there are two groups of inhalers. You've got so-called relievers, which basically give you instant relief because they open things up completely in a very short space of time. However, they only last for usually 2 to 3 hours, and they don't do anything about the underlying inflammation. Now, there's another group of inhalers that are called controllers or preventers. And what they do is they usually contain a little bit of inhaled corticosteroids, so a form of steroids, and where they are useful is they address the underlying issue of asthma, which is the inflammation or swelling. And that's where by using it regularly, you'll find that the asthma becomes better controlled. Sometimes you find inhalers that can do both, because what you want to do is you have, for example, if you have reached a point where you already have an attack, then you need both. You need both the reliever to give you that instant relief, as well as the steroids or the inhaled corticosteroid, which gives you the medication to address the swelling. Now, that's very important because sometimes we find that some patients only want to use the reliever, the blue inhaler or the salbutamol tablets, where by taking it, you feel better, but unfortunately, it's a very temporary solution. And once again, we need to go to the root cause. So, to simplify your question, no, there isn't only a case of using inhalers when you have an attack. If you have an attack, you must address both the symptoms, how you feel, as well as the root cause. But if things are not well controlled, then you should be using a preventer or controller inhaler in the first place in order to prevent things from getting worse.
Okay, yes, definitely. Okay, now for myth number 3, right? Asthma isn't that serious at all. What do you think about it?
Now, I would say in most circumstances, now by and large here, we're talking about maybe upwards of 90%, asthma is something that you can control very well. So remember I told you can't be cured from it. But you don't actually want to achieve a cure in the sense that just because you don't have a cure doesn't mean life is abnormal. You actually can lead a very healthy, normal life with the right medication and if you avoid certain triggers. But at the same time, it's not something to be complacent about because the flip side to it, if you do not adhere, if you do not comply to the medication that you need, then the inflammation can worsen. You may find yourself in situations where unfortunately the narrowing of the airway becomes so severe that you are unable to breathe in enough oxygen to the point where there's not enough oxygen for your body. And of course, if that continues for too long a period of time, it becomes fatal. Now, unfortunately, we still do see a lot of deaths related to asthma. And by and large, the huge majority of them are related to people taking the medication either incorrectly or too late. So it also means that as a doctor, it is very, very disheartening. It's very, very depressing because a lot of this is avoidable. So yes, it is something that by and large is very straightforward in terms of using the medication, but we must not take it lightly because when it goes wrong, it can go horribly wrong.
True. Yes, definitely. I agree with you because when I was a child, back those days, right, there was not much about understanding asthma or what parents should do to help prevent it from happening. So back as a child, it was very difficult for me. We had to rush to the hospital every now and then.
Right.
But now with all the educations and helpful doctors around with us, I think I have a better control of my asthma and I'm having a healthy lifestyle right now.
That's good because ultimately the aim, right, is for you to be no different from any other person. Breathing isn't something we should be conscious about, something we should be thinking about. It should happen naturally. And that really is the goal of all the medication that we give. And once we've reached that goal, the second goal really is to minimize the medication. So finding the right balance for what is enough for an individual is really the key to managing asthma. And I'm glad that you've reached that level at this point in time.
Yep. Yes, thank you, doctor. Okay, so now for myth number 4. People with asthma shouldn't exercise or play any sports.
I disagree with that completely.
Okay.
I mean, were you told that as a child? Were you told not to go out during PE, to stay in classrooms more often?
At home, yes.
Okay.
You should not run. I used to be a marathon runner back in school.
Oh, wow.
So
Okay.
my parents, they were very afraid of letting me to go and run because, sometimes when you run, you catch your breath and sometimes it's very difficult to do it. And parents have this mindset thinking that, oh my God, when you run, you have difficulty in breathing. And if you already have asthma, it's going to worsen. Yep. So I totally disagree with that.
I think you've answered the question, so we can move on. No, because once again, you've given a very good point. You are someone who can run a marathon despite having asthma. I don't have asthma and I can't run a marathon. So that tells you how fit I am, but it also tells you that it shouldn't be a limitation.
Yep.
Now, once again, it goes back to how well controlled your asthma is. So if your asthma is well controlled, there shouldn't be any difference between what you can achieve, what you can perform versus anyone else. And I think it was Paula Radcliffe. She's a very famous female marathon runner. And I think she broke the world record at some point. And she if I'm not mistaken, has asthma. And obviously it's very well controlled, allows her to run at a pace that beats most human beings. So there's, in a way, no real excuse for that. I believe David Beckham also had asthma, and once again, famous football player who can run up and down and very fit and all that. So what we need to go back to is the basics. Once again, you want to control your asthma at the right level. Certain things can be very helpful when it comes to controlling your asthma whilst exercising or exerting yourself. So for example, it's sometimes useful to take an extra tablet called Montelukast that has been shown to work better when you are symptomatic from sports or exertion. And the other thing is sometimes if you know you're going to exert yourself, let's say before you go for a run, if you know you're going to get to a point where your airways will become a little bit more tight, then it may be helpful to take an additional puff of your reliever inhaler before you go out so that things are in a way primed to allow you to do more. And I must just stress the fact that, once again, this shouldn't be an excuse for taking your child out of school, out of PE lessons, because I get a lot of parents asking me that, and I really, really discourage them because, if anything, exercise is good for your lungs.
True. Okay. I remembered that back then my doctor did mention to my parents saying that swimming is good for asthma. Is that true?
It is, because once again, you are actually building up your lung function. You're actually building your capacity. The catch is that if you are in a swimming pool and your asthma can sometimes be triggered because particularly because of things like the chlorine in a swimming pool. So it is, of course, a chemical, you inhale it, and that can sometimes cause that inflammatory reaction. So once again, goes back to ensuring that you have very well controlled asthma with the right medication, and you should be able to swim up and down.
Okay, great. I did went for swimming class too.
Well, there you go. See, I should ask a question. What's the next myth? Let me ask you about it, please.
Okay, so for myth number 5, people living with asthma should not consume anything cold.
Well, so usually the myth is about drinking cold drinks, mandi jangan air basah kepala, or don't mandi at night, those kind of things, right? And you're right, ice cream, things like rambutan, cold food. So sometimes there's this concept of what's heaty for the body, what's cold for the body as well. So this is a bit of a mixed match between traditional thinking about our body as well as modern medicine. Now, to take a step back, once again, if your asthma, if you are at a point where things are more sensitive, then certain things may actually trigger your asthma that are related to temperature. Usually, it's your environment. So if you go from a hot place to a cold place, or even vice versa. If you go from a cold place to a hot place, that change in temperature can actually trigger the asthma, can trigger those symptoms. And sometimes it's to do with humidity as well. So from very dry area to one where there's a lot of vapor in the air, that can also trigger things. Drinking cold drinks, not really. But once again, you can imagine if the area around your airways becomes cold, then it can trigger a bit of a cough. So it can trigger some of your symptoms, but it won't actually make the underlying asthma worse. So a lot of my patients go feeling miserable because they say, I can't eat ice cream, that's me on a hot day, I'm suffering. But once again, I always tell them that you need to balance the medical necessities versus what is, a nice normal life, which includes, to me, eating ice cream. And that involves making sure that you take things in moderation, you take things when things are well controlled as well. So once again, it goes back to control. If things are well controlled, you may have other triggers like cats, for example. So cats are a favorite topic of mine and a lot of my patients, because if you have asthma, sometimes the trigger is the cat. But I have yet to come across any single person who would get rid of their cat because of their asthma, because they would much rather suffer with the symptoms and keep the cat in, because they sayang the kucing so much, right? Which is the right thing to do. But once again, when the asthma is well controlled with the right medication, then they find that actually it takes a lot more for the symptoms to occur, or in some cases the symptoms go away completely. So it's all about finding that right balance.
Okay. Yeah, I agree with that. I can't live without ice cream though.
Well, there you go. So some people have cats, some people need ice cream.
Yeah. Okay, so the last myth. It is normal to have daily asthma attacks.
No, it's not. I had a patient last week actually who came to me having had symptoms of breathlessness, a bit of tightness, a bit of difficulty breathing whenever she does a lot of housework or when she goes up and down the stairs. And she told me she's been living with that for years, because to her, that is what asthma is. You have symptoms, you have difficulty breathing or some chest tightness, and you just live with it. And it was a bit of a shock to her when I told her that most asthma patients do not have symptoms. So going back to what I said earlier, if you have the right medication to bring the inflammation down, if you use the inhaler on a regular basis to keep things at bay, the goal is to be normal, no symptoms, no limitations. If you're a kid, you can run around the field, you're not missing classes. If you're adults, you can, if you want to run marathons, or you can go for a swim. In her case, it was as simple as doing housework and going up the stairs. So the goal is, once again, to minimize the symptoms. And anybody who needs symptom relief, so by that I mean needing to use their reliever more than twice a week, that for us as medical professionals is an indicator that things are not well controlled, and something else needs to come on board in order for us to actually give better control for the asthma.
Yeah. Okay. True. Okay. So the last one. Can you share with us a takeaway message on what people should do when they're having an asthma attack?
Okay. Well, if you have an attack, I think the first thing to do is to not panic. So take control of the situation, try and take deep, slow breaths, because it can be very terrifying. You're essentially feeling everything is constricted very tight. Now, you should always have your reliever inhaler within a close distance. So whether if you're going out, it's in your pocket or your bag. If you're at home, it's somewhere that you know where it's kept at, so it's easy to reach. And do take your reliever inhaler. Take it as instructed, because there are different types of devices which may differ in terms of how we use it. So use as instructed, wait for it to take effect. If after 5 to 10 minutes you feel that it has made no difference, then do take it again. Now, if you feel that despite using it, you take 2 puffs, you wait, you take another 2 puffs, you wait, and it's still not making any difference. If you feel that things are still bad, then do go to your nearest doctor, because you might need something a little bit stronger than just the reliever inhaler that you have in hand.
Okay, so for all our viewers, if you're asthmatic or know anyone who has asthma, then do take note of what Dr. Helmy has said, because it's very important and it could help you or others at times of emergency. So I guess that's all for now, Doctor. Thank you so much
excellent.
for debunking some of these myths on asthma.
No worries.
I know
Thanks
for
for having me.
sure. Thank you. I know for sure that all our viewers will appreciate you for sharing your thoughts on asthma. Also, thank you so much for taking your time away from your busy schedule to join us today. We hope to have
My
more
pleasure.
interviews. We hope to have more interviews with you in the upcoming future.
Okay, you look after yourself as well, and keep running marathons.
Thank you,
and
Doctor.
Eating ice creams. Yes.
I am. I still am. I think the last one I had was 2 days ago.
Excellent. Okay.
Okay. Thank you, Doctor. Bye-bye.
Thank you. Bye-bye.